Okay, so this is for a client that presents with a C2 spinal cord injury, and I'm going to be checking their vital signs, their heart rate, blood pressure, respiration rate, and then transferring them from the wheelchair into the bed and positioning them for sleep. So a lot of this I'm really going to be talking through, because for a client with a C2 spinal cord injury, you have it's a high level cervical injury. So there's like paralysis and sensory loss from like the neck down. And they're ventilator dependent, because also their diaphragm is paralyzed. So really the key to all of this is safety and monitoring. Okay, so when we're talking about vital signs, something to think about is the vital signs might be abnormal to what a typical baseline would be. They can fluctuate depending on what kind of pain the client's in, their position, if they have autonomic dysreflexia, all of those sorts of things. So, for example, let's see. So for heart rate, normally you'd be using like a pulse oximeter. So I could pretend it'd be like one of those little ones that you put on the finger, pulse oximeter, and then listening via just an old school stethoscope, right? And something you'd want to think about with the heart rate is that normally normal general population is like maybe 60 to 100 beats per minute. Oftentimes C2 spinal cord injury clients are bradycardic, so it's maybe more like 40 to 60 beats per minute. We talk about checking vitals for blood pressure. You can use an automatic or a manual cuff. You just want to kind of be cautious of like maybe thinner, lower toned arms, which might be the case since again they can't really move a lot, well, at all. Okay, so I do a blood pressure cuff, and in normal general population, right, you're looking at 120/80. Oftentimes with C2 spinal cord injury clients, they're hypotensive, so it might be like 90/60, or even lower than that. Okay, and then when we're talking about respiration rate, respiration rate is like counting just chest rises, or a lot of times, again, these clients will have a ventilator, so there will be a monitor, we could read it. So let's pretend like it's through that. And normally you're looking at maybe 12 to 20 breaths per minute. A client that has a C2 spinal cord injury, it may be mechanically ventilated, right, or very shallow. You would just want to really watch out for signs of that dysreflexia we talked about, which is maybe a sudden high blood pressure, sweating, goosebumps, a headache, something like that. And that's where we really need help. That's like an emergency. Okay, so transferring, the next step after checking vitals is transferring from the wheelchair to the bed. So this client, again, is completely dependent, and really they're going to require something like a mechanical lift, like a Hoyer lift, or at least a 2-person assist with a slide board and like full body support. I think from my reading that most recommended is the Hoyer lift. And so we would kind of need to explain the procedure to the client, or the process to the client. We would apply the sling, attach the sling to the lift on the machine, and making sure all the straps and stuff are secure. And then we would slowly elevate them, pivot them over the bed, and lower gently onto the bed. What's really critical here is the head and neck support at all times, especially with a ventilator. You would just want to make sure and keep an eye on the ventilator tubing so that it doesn't like disconnect or strain. And again, if no lift is available or you're not using one, you need 2 people to perform a transfer using like a sheet and a slide board. And you would want to be really taking into account like spinal precautions, I guess, for lack of a better term. Okay, and then next thing, something I do want to mention through all of this is you want to add padding as needed to anywhere that's like especially bony, like heels or elbows or the sacrum, something like that. And As we move to the next part with getting in bed, you will want the head of the bed slightly elevated if able, just for like good respiratory function. Okay, so now we'll talk about sleep. So I'm just going to have her go ahead and get it into the bed since, of course, we don't have a Hoyer lift. Okay, so she'll lay down in bed. And supine is the positioning. Okay, and the goal here is really to prevent like pressure injuries and maintain a neutral alignment. Make sure and promote like good respiratory function with like slightly elevated we talked about, and just make sure that she could be like comfortable and safe. So when it comes to sleep positioning, with the head and neck, again, we want neutral alignment, and something you'd probably want to have is like an actual cervical pillow. They have their cervical pillows, so something soft, or even a folded towel roll, something like that. You just want to avoid excessive like flexion or extension. And the arms, you want to have the arms, the sides, or even like slightly abducted, just so that you don't run into any shoulder subluxation. So that's really key to think about with the arms. With the back, you want to have enough support under there because we talked about we don't want to have pressure issues. So having like a pressure relieving mattress would be helpful. When we look at like the hips and the knees, what's important is having like a slight bend with maybe like a knee bolster or a pillow just to prevent hyperextension. So you'd want to just have something maybe just a slight bend and something supporting underneath the knees. I put a towel, you can use a pillow, that sort of thing. Let me switch sides here. So the feet, with the feet, that I guess aren't totally, yeah, they're showing. You want to, if you can, use like heel protectors or foot rolls just so that you don't have like a foot drop or like the pressure sores or ulcers. And then really key with a C2 spinal cord injury patient is turning. So you want to have like a good turn schedule, maybe every 2 hours. And the point of that is to help prevent like skin breakdown. And something you could do is like if you had 2 people, you could do like a log roll just to make sure that they are turned. So those are all the things that you would want to think about for this sort of patient.